Impacting millions of lives and families and straining the healthcare systems worldwide, diabetes affects 527 million adults in 2024, majority of which are in low and middle income countries. This disease burdens the already crippled healthcare infrastructure of developing regions. In the Philippines, the trends of diabetic rise is driven by rapid urbanization, dietary changes, and increasingly sedentary lifestyle, on top of a fragmented healthcare system at the heart of the Philippines' challenging geographic and economic landscape. With 7.5% of Filipino adults living with diabetes, many are diagnosed but are often lost to follow-up. The Philippines, an archipelago, 57% live in rural areas in distant provinces, often living suboptimal lives with low income. Local studies show that these factors are barriers to diabetic care. In geographically isolated and economically disadvantaged areas, or GIDA, patients confront a myriad of obstacles, including long distance to healthcare facilities, inadequate transportation, and limited access to essential medications. 45 to 93% of diabetic patients lost to follow-up in low and middle income countries due to proximity and inadequate referral to medical management. We call for a shift of systems to link networks, whether in these distant areas to city centers, a shift of patient to doctor communication to be more engaged. From systems to patient, we connect with Health Connect.
With Health Connect, we aim to accomplish 3 objectives: collect, communicate, capacitate. Collect. By using existing fragmented medical registries in the Philippines, we aim to pool data on diagnosed individuals. We refer to this as TAG. Whether you are from an isolated island or in the town's bustling population, TAG determines individuals with diabetes, accessible to every healthcare provider. Primary care doctors up to tertiary hospitals can tag. Communicate. Providers gain access to the tag, ensuring the care is continued from one place to another. With people at the core of our agenda, health moves along. At the course of the patient's care, the registry sends a connect. An SMS is notified to both the patient's primary care provider or specialist physician of choice and the patient. Capacitate. Aside from follow-ups, Health Connect aims to empower every individual with diabetes with drug adherence reminders. It's drug o'clock, time to take your medication. With active reminders, we ensure that patients do not miss any medication and is engaged to their care.
Project Health Connect specifically aims to, first, identify and collect patients diagnosed with type 2 diabetes mellitus within a province in the Philippines. Second, create a communication channel between healthcare providers and patients from both urban and rural settings. And third, empower patients and communities by improving health literacy in type 2 diabetes mellitus and medication adherence by 50% from baseline within 3 years. Phase 1 is develop, developing grassroots connections and supportive technologies. Grassroots communications are done through stakeholder and community engagement from rural health units, doctors, nurses, and volunteer healthcare workers. In the Philippine setting, health is mobilized by barangay health workers, an ancillary network of volunteers who are paid only an honorarium for supporting the country's healthcare needs. A formal agreement is done with telecommunications and electronic medical records to build a partnership, and a registry with automated functions is developed. In this phase, we establish the technologies close to home. In year 1, we aim to produce an application with a strong database at hand for municipalities with training of over 100 healthcare workers ready to deploy the system. After we develop, we are now ready to launch.
Phase 2 is launch. A pilot testing in a selected province will be done to do monitoring and evaluation to ensure the seamless flow of information. We're ready to see a robust database and a smooth referral network designed to efficiently manage individuals with diabetes who have fallen off the radar. With this system in place, healthcare providers can easily track patient histories, identify those at risk or those already lost to follow-up, and swiftly intervene with tailored strategies to re-engage them in care. Launch will be able to ensure that we are able to call out possible issues as we move along to Phase 3, expand. the application will be set nationwide, addressing the country's fragmented healthcare system, unifying records at the convenience of every Filipino.
By the end of the 3-year project, expansion phase has culminated. We're covering bases from the end to end of the Philippines with more than 30 provinces seamlessly integrated, the others transitioning.
Project Health Connect made use of the theory of planned behavior and the protection motivation theory in coming up with an approach to address identified problem. Initially, we look into the attitude, perceptions, context, and perceived control of Filipinos with diabetes, as these factors would reflect the behavioral intention and the subsequent behavioral action taken. Through the protection motivation theory, a person's perceived severity, perceived vulnerability, response efficacy, and self-efficacy are considered to protect themselves. It emphasizes the role of persuasive communication for a behavior to emerge. Thus, this system would be able to simplify various factors a person usually considers when making a decision. It would be a credible source that can communicate clearly the issues at hand, actions to take, and the urgency to be able to motivate people to engage with appropriate health-seeking behaviors.
From this theoretical approach, we created a plan with the objectives and phases in mind. Translating it into the step-by-step methodology, we used a logical framework approach. We have 3 core objectives. First, to identify and collect patients diagnosed with type 2 diabetes mellitus within a province in the Philippines. Second, to create a communication channel between healthcare providers and patients from both urban and rural settings. And ultimately, to empower patients and communities by improving health literacy in type 2 diabetes mellitus and medication adherence by 50% from baseline within 3 years. The logical framework approach is an approach on strategic planning to systematically and analytically process objectives-oriented planning and management with the end goal in mind. Activities are developed, objectively verified, and persons assigned are identified. To connect the community with healthcare providers, regardless of their urban or rural setting, a communication channel will be created with Health Connect. A budget of $10,000 for telecommunication services and $300,000 on the development of the application Health Connect will be allocated. Another $1,000 is allocated for community engagement, co-creating with relevant stakeholders on the innovation and going through towns and provinces to set our footing on ground. $5,000 will be allocated for marketing Health Connect to the general public, ensuring that everyone is informed, encouraging everyone to be enrolled.
By investing in technologies and networks, we ensure we cover everyone. By investing in an alert system, we strengthen the adherence of an individual with diabetes. With Health Connect, you invest in systems and people. You invest in hope. Despite high cases of diabetes set in a country with low resources, we believe there is hope, a chance to shift the narrative, one that is centered to the people, connected by the system, by collect, communicate capacity. In steps 1, 2, 3, we bring Philippines close to diabetes free.